Today we'll be talking about depressive mood disorder. Depressive mood disorder comes in three categories of mood disorders. Major depressive disorder, classified as MDD, dysthymic disorder, and depressive disorder not otherwise specified. All three categories of depression share many of the same symptoms. Depression, anhedium, change in appetite, change in sleep, agitation or slowing, loss of energy, decreased concentration, or difficulty making decisions, thoughts of suicide or death, and feelings of guilt or worthlessness. In major depression, the criteria are symptoms must last at least 2 weeks. They must last all day, almost all day, every day. They suffer from depression or anhedemy, along with at least 4 other symptoms that were listed previously. Major depressive disorder, single episode, is when there is only one episode and it does not have a history. Major depressive recurrent is when a person suffers from major depression more than one time. And neither one of these can be related to any other disorders. Dysthymic disorder lasts at least 2 years, and the symptoms appear on more days than not. The disorder consists of at least 2 of the symptoms we already discussed. Depression not otherwise specified include premenstrual dysphonic disorder, recurrent brief depressive disorder, and many others. This diagnosis must be for depression not connected with any other disorder or medical condition or medications taken. Depression has been linked to substance abuse, alcohol abuse, many medical conditions, medications, mental health issues, and stressors or losses. When assessing for depression, it is important to look at all aspects of the client's life: physical, mental, spiritual, and environmental. For assessing depression, common tools are self-reporting measurements such as Beck Depression Inventory, the Zung Depression Scale, the Montgomery-Åsberg Depression Rating Scale, and the Profile of Mood States. It is important to remember that some symptoms of depression, such as fatigue, may be misdiagnosed as depression, especially in the elderly population who may be suffering from chronic illnesses. The changes that will be coming from the DSM-4 TR to the DSM-5, the DSM-4 places an exception to the major depression as bereavement or grief. This means that if you have someone who is going through a loss, they would not be considered as depressed. In the DSM-5, this exception has been removed, and because it does recognize that grief can last up to 2 years and that it can be severe psychosocial impairment. New depressive disorders such as disruptive dysregulation disorder and premenstrual dysphonic disorder are also being added to the DSM-5. The new research that goes with depression show that depression affects both the old and the young. And right now, researchers are looking into the possibility that genetics may play a role. The majority of research done on genetics has been in the major mood disorder. Research is also looking at the functioning of brain and what areas are associated with depression. There is also new research linking depression with learned or modeled behavior. Coping skills are modeled after actions of caregivers by younger children. Depression can be successfully treated with psychotherapy, antidepressants, or a combination of both. They are looking now into newer treatments, including exercise, which is showing promise for treating depression. Lifestyle changes such as diet, sleep, stress reduction, and social support groups have also been shown to improve the depressive symptoms. Acupuncture is also being used to treat depression in different groups of people. This would include patients who are possibly pregnant women. Thank you for listening.